Hello everyone. So today we are going to talk about my personal experience of applying for a psychiatry training post in the UK. As all of you know, probably that psychiatry is still on a shortage occupation list. Psychiatry is a very interesting field, and it gives you a very good work-life balance. So it was, I think, a good decision to get into the psychiatry training. Regarding applying for it, there is a website by the name of Oriel. You can Google it, and then you have to sign up and make a account online via your email address. After doing that, you have to put in all of your personal details and then your work experience, the places you have worked, and what kind of work have you been doing, all the courses that you have attended, and the details of your referees as well you have to insert. There is this thing called CREST Form that you have to complete and upload it onto this website. It is very important. This means certificate of readiness to enter the specialty training program. This needs to be completed by a consultant who you have worked with in probably the past 3 years for maybe at least 3 months. You'll have to look it up. I can leave a link about it in the details in the description below. And then you just wait for the openings on the training post, and you when the post has opened for applications, then you obviously apply online, and then the next stage is you wait for the MSRA exam appointment, which is the multi-specialty recruitment assessment. So once you have gotten the appointment booked for the MSRA, then you need to be looking into the preparation. Some people start preparations early on. So basically, the MSRA exam is divided into two parts. One is professional dilemmas, and the other is clinical problem solving questions. The professional dilemmas are basically these situations that at the doctor at the F2 levels usually come across in the wards, in A&E, in theaters, in various clinical scenarios, in clinics. So you are given a situation, and then you've got four or five options, and you have to rank them in the order of priority, or in the order of the way you would do things step by step in that scenario. So there are 58 questions. 8 of them are pilot. So you'll be marked only for 50. There is no negative marking. So you'll be given 10 minutes to attempt all these questions. Some of them can be ranking. A very little number of them can be multiple choice questions. And then comes the clinical problem solving questions. There are 97 questions, and out of them 11 are pilots, and you have to finish this in 75 minutes. Some of these can be single best answer. You have to choose a single best answer. Sometimes you have to choose two answers, and sometimes you have to match the options with each other. They are mainly all clinical questions, like you have been doing in your academic exams, mainly about medicine, surgery, and a few questions from the other specialties as well. Again, I will leave a link of the sample test and the syllabus in the description as well. So I've already told you there is no negative marking. There is one thing called Specialty Recruitment Assessment Bypass Score. criteria. There is a limit. I think it's above 550 or something. If you hit that criteria, if you score that much, then you just don't have to appear for the interview at all. You get offered post just purely based on your theoretical exam. Now, how are you going to prepare for MSRA? There are a lot of resources, and it all depends how much preparation you need, really. So, if you really have been away from studies, you have taken a long break from after your graduation or foundation years, and you're now thinking to go back into training, then you'll probably need to start with Oxford Clinical Handbooks. You need to just revise all your knowledge of those clinical subjects. Otherwise, you just only can go and just practice questions and read the descriptions of them, and yeah, most of the cases should be alright. A lot of resources online available there. Past medicine, past test, eMedica. I personally used eMedica. I found it helpful. Then you have to, after doing these completing these resources, basically what you do is you have to, for example, what I did on eMedica is you have to do questions for each subject separately, and then each topic in them separately. For example, in medicine, I would have I had to do CVS, cardiovascular, respiratory, endo and renal, everything basically separately. And then once you have finished all of that, at the end of that, you have to then revise. You have to do mock tests. The mock tests are just like the actual exam kind of setting. Exams with the same time and everything. This is all given on these online websites. So the thing is, when you go for the exam, you basically need to thoroughly understand the scenario. That is the main thing. And then you also need to understand the question at the end of that. What are you being asked? Sometimes they ask you, for example, what would be the initial investigation versus what would be the diagnostic investigation, something like that. So there is a very there is a difference in these questions. So initial can be for something X-ray or a blood test maybe, and the diagnostic would be like a CTPA or something like that. So you need to be very clear about this, because no matter how much you prepare, you might lose marks on these very minor things. And then time management is really crucial. You have to really practice hard in your mocks so that you manage your time appropriately. Interview. So I appeared in interview at Etihad Stadium in Manchester. It's all national recruitment. There is no local interview centers. Everyone must go to Manchester and appear for their interview, really. So there are two stations in there, really. One is a clinical scenario, and the other one is a portfolio presentation. In a clinical scenario, these questions will be released almost a week ahead already, before the interview, so you'll have plenty of time to read and prepare for them. So the clinical scenario station would be a 10 minutes interaction with the patient. The scenario will be completely be available online, and then there would be 5 minutes with the examiner. I cannot discuss the specific scenario with you on here because of some legal reasons, but basically these scenarios involve assessing a lot of mainly your communication skills, and it's not mainly about your knowledge. It's mainly about your communication skills. It's mainly about how you manage very difficult interactions with the patients, and how you recognize their emotions. How do you recognize your own emotions, and then in an effective manner, how do you um, manage the whole situation really. So I think that's what it was about for me. Portfolio presentation is basically 15 minutes of you continuously talking about what you have done and why you come to psychiatry and everything. Please, please, please do not make the mistake of taking your iPad or showing your portfolio on your iPhone and stuff. You must buy, go to WH Smith, buy a hard copy portfolio where you can put your, where you can put sleeves in, and the plastic sleeve, and you can put your A4 size, certificates and degrees and all the other stuff. So you need to be very well prepared for this. There should be what I did is basically I divided it into few sections. First of all, it was my name, and then it was the contents of the portfolio. Then it was my CV. Then it was my qualifications, my degree, GMC, IELTS maybe, and then it was a commitment to psychiatry section where I had done, taster week in psychiatry, and that meeting with my consultant, and some online CPD courses, stuff like that. Just throw everything there, and just make it as presentable as you can. Make sure that they are all colored copies rather than just a plain black and white. Just make it a bit more catchy and everything. And then you have to include some presentations that you have done. Just include 4 or 5 slides, important slides from them. You must include feedback from those presentations, because the examiners, they really asked me to take out all those papers from some of the papers from the portfolio, and they thoroughly read it even in those few minutes. So just be very careful about this. And then there is a teaching section. Sorry, this is what it is. Teaching section is you have to include your presentations and everything. After that, there would be a research and publication section. You could put in your any research you have done, or you have been involved in, any audits you have done, all of that stuff. And then it comes to clinical courses. So all the clinical courses you have done, any kind of courses you have done. Just focus mainly on psychiatry, mental health, or communication, or that kind of stuff. But even if you have done other courses like BLS and all that, just include it in there. And then basically at the end, it was the extracurricular activities. I live in the south. I like water sports. I swimming and kayaking and stuff, just, and tennis, these kind of stuff. Just put some color, nice photographs in there, and it just tells them that you look after your self as well. You have a good balance in your life, and that kind of stuff. So yeah, there you go. Just few main things about the clinical scenario. I have already explained a lot in previously, but just actively listen to the person. Be non-robotic in your attitude. Show more empathy. Address the concerns, and at the end you'll be questioned by 2 examiners on how about the exam and the scenario. Portfolio, as I already told you, there will be a hard copy. You should buy a hard copy format and print off everything and put it in there. You have to be very well rehearsed. You have to spend more time on commitment to psychiatry portion. you have to be very, very clear why you are choosing psychiatry and what are your motivations. And include a lot of stuff related to psychiatry. Um, After the interview, you'll be given results in next day or a couple of days. You will be scored out of 30 in theory. It's kind of a technical thing, some weird score out of 30. And then the clinical scenarios would be 30 and then portfolio 30. You will be given an overall rank, so which means, for example, there are 100 there are maybe 500 people who appeared for the post. What is your number? Where do you rank based on all the scores and everything? So just kind of, very, very thoroughly research before setting your preferences, where you want to go, the area, the hospital, the team, the settings, the deanery, everything. Yeah, best wishes, guys. I hope you do well, and you get all the post where you want, and you just thoroughly enjoy your training. Best of luck. If any questions, just post them below.